Hi, this is Dr. William Yates, again talking about a very good subject, one favorite of mine, FUE, FUT, in the hair transplant field. One of my patients who just had a long session of FUE brought me an article from the Hollywood Reporter magazine that was just in last week. And basically the article says, LA, the new breakthroughs in the battle of the bald. And what it's talking about, back in the 70s and 80s, everybody who was chic wanted to just have a tan. They wanted to look, like they were just bronzed and tan. But now, as everyone's aging through the millennium, that it looks like everybody now wants to have their hair look better because it gives you a more youthful look and it frames your face. So in this article, they're mentioning a lot of dermatologists in Hollywood. They're mentioning surgeons in Hollywood. And they mention the NeoGraft procedure, and a lot of you don't know, but NeoGraft is FUE. A lot of people come and ask me, what is NeoGraft? NeoGraft is just an instrument that helps you perform the FUE procedure. I kind of make the analogy, if you play golf, say I use TaylorMade clubs and somebody else use ping clubs, it's just the same thing for FUE. NeoGraft is a type of instrument. And the instrument I use is the Harris Safe System. So NeoGraft is not a procedure. You can't ask for a NeoGraft procedure. You can ask for, do you use the NeoGraft? And it also talks about another doctor here in LA that uses fine hair on the leg by the FUE process down on the leg to kind of soften the hairline. And I'm not familiar with that technique. I think, that sounds great, and this doctor has a good reputation, but that's why FUE is so vital, because when you do a strip and you take out hair from the middle of the head over to the side, the hair sometimes doesn't match up with the hairline hair, which is much finer. And even though you're doing your best job to pick out finer hairs, it just doesn't work. So that's why FUE is better in my mind, because we'll go down to the nape of the neck and get better, smaller, finer hair to use in the hairline to make it so natural that you can't tell. And this is the idea that the doctor in LA is using leg hair to do that same thing. I don't use leg hair, but I will go down to the nape of the neck. So let me just go through a checklist, just like a pilot would before taking off a plane, of why I think FUE makes more sense than a strip procedure. And I just had a patient yesterday and called me back, and and it's very good for patients to go around and see a lot of doctors. And he went to 2 or 3 doctors, and the doctors, this was a young patient, the doctors recommended that he have a strip for 3,000 grafts first, and then later on have FUE if he needed it. Now, and hair transplant surgery is not like cancer surgery, so it's not like something, if you don't do this, something really bad is going to happen. But I don't see any sense at all in that kind of thinking, because number one, you don't want the cut anyway. But all the things you hear about not being able to move lots of grafts in one time, totally false. All this is operator dependent. We move 2,500 to 3,000 grafts in one day all the time. Okay, the things about the grafts not growing, again, totally false. The grafts in FUE grow just as well or better than any strip that I've seen in my life. Number 3, the things that you hear, well, when they do FUE, they tear up the grafts. I don't know who they is who are tearing up the grafts, because everybody that does operator dependent, that does FUE is operator dependent. Somebody else might tear up the grafts. That's called projection. They're projecting what they do onto somebody else. But like anything else, somebody who's mastered a skill will not tear up the grafts. So the grafts are not being torn up. So all those things are just floating out there, and then people go from one doctor to the next, and of course they get mixed messages. So let's just go down a quick checklist that I want you to do. Okay, so would you agree, everybody who has a hair transplant, number 1, you want the hair up here, because everyone focuses up here, to look good and look natural. In my mind, naturalness trumps density. You want both, but if you had to choose, you want to get naturalness and density, but naturalness always is going to trump anything. So, do you want your hair to look natural and look good up here and grow and feel like you get your money's worth? Most people will say, yes, I do. That's why I'm coming to you. Okay, so we check this box, yes. If you had a choice, would you prefer not to have a cut in the back of your head, ear to ear, okay, and depending on how big your head is, ear to ear, my head's this big, and about this wide and about this deep, with stitches that have to come out or either dissolve to get this result. Okay? Would you want that as opposed to small 1 millimeter or so mosaic type punches over your scalp that go about 4 millimeters deep all over the scalp, which are hidden by the hair? What would you rather want? I can tell you that if the hair is going to grow the same, 9 out of 10, and I don't know why it's not 10 out of 10, are going to say, of course I don't want any cut. I don't want any stitches. And when all this is done, you don't want a scar. And I don't care how pretty the scar is. A scar is what? A scar. Scar tissue is fibrotic tissue, okay, that sometimes is numb. Sometimes when you cut your hair short, you can see it. Okay, so we're saying no stitches, no scar, no cut, no whatever. So that, check that box. Now, choices. A lot of young guys come to me and say, I'm not going to cut my hair. I'm not going to do this. I'm not going to do that. And the truth of the matter is they don't know what they're going to do next Tuesday. So how do they know they're not going to cut their hair? The only reason they're saying that is because the situation that they were in earlier, money-wise, seems to fit with them. So if somebody says you can have the surgery for $2 a graft and get 6,000 grafts, they're like, where do I sign? Okay? And sometimes that's not the best decision. Okay? The key in anything you want to do in life is the ability to have choices. It's just not hair. It's financial, health, in your job. The key to happiness is having choices, that you're not locked into one thing. You don't want to be locked into anything. You get a scar in the back of your head, you're locked into wearing a certain hairstyle in the back forever. Okay? You don't want that. So, most people would agree they want choices. So we've checked all these boxes. If you check all these boxes, there's only one operation that's going to be suitable for you, and that's FUE. And I don't know why so many people deny it or run away from it. A lot of doctors in the United States are masters at FUE. I see on a lot of forums people going to Turkey, to this. There's no need for that. There are plenty of doctors in the United States who have mastered this technique, and those doctors that they're running to overseas come over here to learn from those doctors. Now, are there any downsides of FUE? No. And I want to just show you one more thing. A lot of people say, I don't want to shave my hair to have the surgery, okay, for FUE. Okay, we've solved that for you too. There are two ways to do it. We call it no-show FUE. You can either shave like a strip of hair wherever we're going to go and leave the hair on top long, so when we're done it flops over, okay? That's one way to do it. Another way to do it would be to go down to the scalp, and in little sections, you know, we would mosaically kind of trim the hair that we're going to take out, you know, and leave the other hair long, so we go all over and still do the FUE with fairly long hair. If you keep your hair long with the no-show FUE, we cannot do the artist system. The artist can't get in here and find the hair. Just can't do it. But if you don't want to shave your hair, we have the answer for you. So any way you look at it, we figured out a way for you to have a FUE procedure. I do think the procedure is here to stay. As you see from the article, everyone in Hollywood, and as Hollywood goes, the rest of the world goes, are embracing hair transplants because everyone knows now it works. It's not 1972 where you're going to see plugs and, you know, guys are on TV and, you know, swimming with a glass of wine, and you have to go to places like this. Those days are over. Real medicine has embraced the hair transplant process, and we're making it better for you and for me. Everything I've told you, I've done. I've had FUE, I've had strips, so everything that I've told you that I recommend to do to you, I've done. So this is Dr. Yates, again, big proponent for FUE. Young people, you know, for sure, I just do not believe getting a scar on the back of your head, no matter who's convincing you to do it, is a good idea. Let me know. Thank you.